Aging Zoom event. And myself and Joan Wiley are the hosts for today for this Zoom event. And we have Carrie Duncan, who is an OUTniagara admin person and extraordinaire, I must say. And Carrie will be doing the back end tech today, along with Shauna, who is a student at Brock in the science department and has an interest in gerontology and aging and the cognitive effects of aging on older adults. So we welcome Shauna. It is also doing tech for us today. So if you have any tech questions or difficulties, please, you can use the chat to connect with Shauna or with Carrie. Okay, and we're going to start our event with a land acknowledgement, and Carrie's going to be doing that.
I'm on mute. Welcome, everyone. As Judy mentioned, my name is Carrie and I'm a staff member at OUTniagara. And in positioning this work, whether it's in healthcare or dental care or activism or community advocacy, we always want to be working from a position of working in solidarity with Indigenous communities and Indigenous struggles happening ongoing. And one place to start with that is through land acknowledgements, not as a singular action, but an ongoing commitment to all of our work and knowing that it's linked to all of our work. And so I know we have many folks joining us from different locations today, but this event was primarily organized in the Niagara region, which is the traditional lands of the Ongwe Homeway. And the shared territory is held by the Haudenosaunee, the Anishinaabe, the Wendat and Chinantan peoples, and is also home to many different First Nations people from nations all across Turtle Island, as well as Métis people and Inuit people. And so their stewardship and leadership around protecting our lands and fighting against a government that continues to exclude them from many systems is something that we want to bring into this conversation today to start things off and think about the fact that we're all working under various treaties and nation-to-nation relationships. So in Niagara, a key treaty governing the territory is the Dish with One Spoon Agreement. This pre-colonial agreement between the Anishinaabe, the Mississaugas, and the Haudenosaunee binds them to share the territory and protect the land. And subsequent Indigenous peoples, settlers, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. And thinking about the treaties in our region, we're actually home also to the Treaty of Niagara, which, while not acknowledged by colonial governments and services, is foundational information that I would encourage everyone to look up in understanding our nation-to-nation relationships and really invoking the two Wampum principles that also govern our region. And thinking about how this isn't just a historical issue, but brought into the work that we're doing today, I think about how the legacies of colonization, racism, and capitalism are upheld through ongoing attacks we see happening on trans and two-spirit folks, Black folks, Indigenous folks, and other people of color, and how this often gets reinforced in healthcare issues and exclusionary healthcare issues that don't prioritize cultural competency. There's going to be a link in the chat, but specifically thinking about dental care, in 2017, a report came out from Health Canada that found that Inuit and First Nations people are twice as likely to have dental disease in Canada under current healthcare systems and practices due to inaffordability, lack of access, lack of regular visits, and and really lack of access to culturally competent dental care. And I know there's a lot of folks who are really passionate about this topic who could speak a lot more to it on the call today. But I just want to call attention to that because I think in Niagara, we're all trying to break down silos and share information with one another as much as we can and have events like this. And I think any opportunity we have to share our resources, whether it's financial or information based, is important. And so one other piece of information I want to share with you is not dental related, but healthcare related, in that Mani Chakabi, who is Ontario-based Ojibwe Cree Two-Spirit elder and also writer, so a predominant leader in many of our communities, is currently in support of a kidney transplant. And there's going to be information in the chat from the Native Youth Sexual Health Network, who are real leaders, I think, in the province and the country around healthcare for Indigenous folks. And sorry, I just wanted to share that information with you and encourage folks to always be sharing as much information as possible, working towards taking action. But with that, I'll hand it back over to Judy and Joan, and thanks for coming today and letting me share some of this stuff.
Thank you for that introduction and the land acknowledgement. I'm just going to do a couple of housekeeping things in regards to this event is being recorded. So I would ask, if you don't want your photo image on the recording, that you shut your camera off. And during that time, if that's something that you don't want your image recorded. And also I would ask that you keep your microphones on mute unless you're asking a question. That way it makes it easier for everyone to hear. And I would also like to indicate that this is a safer space. And in regards to that, we will be using the OPIRG safer space policy for our event today, as we just don't have one developed on our own yet for events such as this, and it's something we'll be working on, but we will be operating under the safer space policy that's listed in the chat. And we will remove anyone if they violate making comments that are not respectful and that are discriminatory in any way. Okay, and at this time, I'll do a welcome to our presenters for today. And we have Shannon Douglas from Quest Community Health Center, and we have Alesha from the Niagara Falls Community Health Center. We have Anna from the Bridges Community Health Center, and MC from the Centre de Santé. And they will be doing a presentation in regards to the Ontario Seniors Dental Program. And then following that, we have a special guest, Felipe Souza da Costa. And Felipe is a dental student at Western University. And Felipe will be doing a presentation in regards to why it matters having this Ontario program to access, as well as dental care and aging. Okay, so we'll get started with the presentation from the Community Health Center on the Ontario Seniors Dental Program.
Okay, perfect. So everyone can hear me okay? Thumbs up. I think my mute is off. Perfect. So thank you for having us here today and allowing us the opportunity to talk about the somewhat new Ontario Seniors Dental Care Program. We sometimes, and you'll probably hear us refer to it as the OSDCP, just because it's a mouthful. So the Ontario Seniors Dental Care Program priority is ensuring that Ontario's low-income seniors age with dignity and enjoy the quality of life that they deserve by providing them with access to free, quality dental care keeping them healthy longer and out of the hospitals. It's estimated that once this program is fully implemented and all of the centers operational, that over 100,000 low-income seniors across Canada will benefit. Across Ontario, I'm sorry. The OSDCP operates and is available through public health units, Aboriginal health access centers, some mobile clinics, as well as community health centers across the province. Next slide, please. Thank you. So for those of you that aren't familiar with community health centers or CHCs, CHCs are not-for-profit charitable organizations. They focus on keeping people well and not just treating them when they are sick. So community health centers deliver primary healthcare services in combination with health promotion and illness prevention services. They are governed by community members working hand in hand with those in which they serve. CHC's priority is improving the health and well-being of populations who have traditionally faced barriers to accessing health services. They've been around for a long time, since the 1920s. There are 74 across Ontario and 5 here in the Niagara region, which include the centers where the presenters today work. Next slide.
So, dental health community worker. I usually get the question, what is a dental health community worker and what can they do for you? So one of the things that we can do is that we assess eligibility for free dental services for those who are 65 and over. So as we go through the presentation, we'll talk more about the Ontario Seniors Dental Care Program and how for those who are 65 and over, how they can qualify. For those who are not 65 yet and still have some time, don't worry. We, as dental health community workers, we encounter all clients. So the youngest client that I've encountered is actually 9 months. So I've helped navigate where they can go for dental services. So we help all ages. Another part of our role is that we help reduce transportation barriers to dental care. So a lot of the barriers that I've encountered as well with a lot of our clients, that they have transportation issues. And so as a dental health community worker, our goal is to break down those barriers. So we would then assess that client to see if they can qualify for either a Niagara Specialized Transit, Red Cross, Caravan. So we'll go through all that process with the client and see what they can access. We'll help them fill out the application and get them set up. Another part of our role is denture accessibility, whether that is if you're needing a top and bottom full dentures or even partials, we will help locate within their area where you can access and see where dentures are available for those clients. As a dental health community worker, part of our role is also to evaluate health and social needs of all clients and connect them with community resources. So I like to tell my clients, dental is not a one-stop shop. I like to make sure that and ask the question, are there any other things that you're looking for or any other services that you might need? Whether that might be counseling services, dietitian support, if they're needing primary care, so like a physician or a nurse practitioner, we will then go up, assess that client and see what we can connect them to for community resources. Last but not least, we also assist with oral health education. So last month was Oral Health Month, and we as community health workers, we banded together and we created a social media piece, and we provided different topics such as how to tame a masked mouth, tips on good oral health, smoking and oral health and how that relates. And also we recognize both the registered dental hygienists and how important their role is for the dental program.
So we just want to provide some background information on some of the dental concerns within Ontario. So every year there are many people that experience preventable dental issues, things like gum disease, infections, chronic pain, that bring people into the hospital emergency departments to seek support. Last year, there were more than 60,000 emergency department visits in Ontario that were due to dental concerns. Many of those individuals were seniors. There are many challenges that seniors face when they try to access regular care. because many are unable to afford or access preventative dental work. And this can then lead to folks experiencing more serious, complicated dental issues, and it can have a huge impact on the overall health and well-being of the individual. So the Ontario Seniors Dental Care Program was created to provide free, high-quality, routine dental work to these eligible seniors. And the hope is that it will reduce the number of dental-related emergency department visits each year, and overall, it will just improve the quality of health for those seniors.
I think Anna just went through this. So seniors, more than any other age group, tend to be more prone to oral health issues, such as gum disease, oral cancers, tooth decay, tooth loss. And if all those problems are left untreated, they can lead to chronic conditions, not just chronic condition of the mouth, but of systemic issues. So by treating the oral health issues, we help prevent chronic conditions from either worsening or developing in the first place, giving seniors a better quality of life. And, you know, just smiling too, if someone has poor impression of their smile, it could just affect their mental health as well. So it's not just the physical health, it's the mental health aspect of it as well. Okay, so who is eligible for this program? So in order to qualify for the program, an individual must meet these criteria. So they need to be over the age of 65. They must have a residence or an address in the province of Ontario. For a single applicant, their net income must be below $19,300. And for a married couple or a common law couple, a combined household income of $32,300 or less. And then lastly, they must not have any other type of insurance through either a private insurance through the work, their previous employer or their spouse's employer, or government benefits such as OW, ODSP, or non-insured benefits. If someone is not sure if they meet these requirements, we always encourage people to apply. If they don't have access to their tax statements or they don't know where to look, it doesn't cost anything to apply. So it's always we always recommend that people do. And the income line that they assess is line 23600 of the income tax. Now, great news, the ministry has recently announced that for starting August 2021, they will actually increase the income threshold for the program. So for a single person, it's going to increase from $19,300 to $22,200. And for a married couple, it's from $32,300 to $37,100. It's great news that will allow approximately 7,000 more seniors across the province to access this service in the year to come. Now, in order to be assessed under the newer income threshold, an applicant will have to wait until July 1st of this year, 2021, to apply, or they will be assessed under the old requirements for the program.
So what is covered underneath the Ontario Seniors Dental Care Program? So checkups including scaling, fluoride, and polishing is covered. Repairing broken teeth and cavities, x-rays. So each community health center, we do have x-ray machines on site, so they don't have to go anywhere else. It's a one-stop shop there. Removing teeth, extractions, or any abnormal tissue. Anesthesia is covered, treating infection and pain. Dentures is partially covered underneath the program. So clients who are enrolled with the OSDCP program, they have to do a co-payment of $80. So whether that is a full top and bottom or partials, they will be talking with their dentist to see what would that look like. And also what's covered underneath the program is treating gum conditions and diseases.
So in order to apply for the program, there are two ways to go about it. The first is you can apply online at www.ontario.ca/seniorsdental. But when you do apply online, you still are required to, after you fill out the online application, you have to print out a consent form, fill that out, and mail it to the Ministry of Health. and you must do that within 30 days of applying online. The second option is to contact one of us dental health community workers in your area, and we can support you in getting an application if that means us mailing it to you, dropping it by your house, or you coming into our center and picking it up. And we can also support you in filling out the application. And we do have applications available in both English and French. And we will provide the contact information for each one of us at the end of the presentation, so you know who your local community health worker is. And so when you apply, you do need to give us some certain information. The first is your date of birth. The second is a valid Ontario address. And we will require your social insurance number or temporary taxation number. This is required because the Ministry of Health actually uses that information to verify your income. And then lastly, you will need to have filed your taxes last year. So now that we're in 2021, it's your 2020 taxes that the eligibility is based off of. If you have not had your taxes done though, we are able to connect you with resources within the community in order to assist you in getting your taxes done.
Now, if an applicant doesn't have a social insurance number or has not filed their tax return for the most recent tax year, that is not a barrier to accessing this service. There is a special form that a client who doesn't have a SIN number or has not filed their taxes can apply to the program through, and that's the Ontario Senior Dental Care Program application through a guarantor. And then you must get a guarantor to help you fill out the application. So essentially, a guarantor is someone who can verify your identity, where you live, and a guarantor must be someone who is a Canadian citizen, at least 18 years of age, and they must be a member of a provincial college in good standing. So there's many examples of people who can act as a guarantor. So a guarantor can be, for example, could be a family physician, a nurse practitioner, a nurse, a dental hygienist, a dentist, a veterinarian. The list is pretty long. The only thing with this application is it cannot be completed online. It has to be completed on paper. You can connect with one of us to get a paper application. They are also available online through the ministry's website, where it can be downloaded and printed off. Okay, so once you apply for the program, you'll need to either send in the consent form from the website or the paper application. And then you can expect to get a response, usually within 4 to 6 weeks. Sometimes it's a little bit sooner. And if your application is approved, you'll get a welcome package in the mail, which will include a dental card. Now, the dental card is a paper card, and it's kind of like a little punch out thing. It doesn't look like a credit card, so some people aren't sure if that's actually the card, but it is. That is what is accepted as proof that you are enrolled in the program. It will have the applicant's name on it, as well as their client ID number for the program. The card will always have an expiry date of July 31st every single year, regardless of when you apply. So if an individual filled out an application with their social insurance number on the application and they have filed their income tax in a timely manner, they will be automatically reassessed every year and will be reissued a new dental card for the following year. Applicants who did an application using a guarantor will need to reapply every year in order to continue receiving services. And if a client has not filed their taxes in a timely manner or was not able to for the last previous year, they will also need to reapply. So it's important to try to, if possible, to do your taxes before the deadline to avoid any disruption in services.
Okay, emergency visits. So often clients present to the program and have not yet received or applied for the Ontario Seniors Dental Care Program. We still will see these folks for emergency and urgent appointments. In dentistry, a true emergency situation is defined as anything including oral face trauma, significant infection, prolonged bleeding, or pain which cannot be managed by over-the-counter medication. So at this time, we do book one appointment for the client. They come in and they must sign an emergency and attestation form stating that they indeed meet the eligibility criteria and will promptly apply for the program, and that a client card is needed and necessary to receive services moving forward. As we've all mentioned, I think in each slide, is our goal is to keep folks out of pain and also out of the emergency room. So locations, currently the Ontario Seniors Dental Care Program, the only place operating currently today is at Quest, and that's where I work, and we're located at 145 Queenston Street, which is across from the old St. Catharines General Hospital. We're currently the only center operational. However, the other ones I think they'll speak to when they will be hopefully opening soon. As we're very busy, we've been seeing clients everywhere from St. Catharines to Fort Erie, including some places, we have a lot of clients that are coming from Toronto as well. And just to note that our health services are available in a variety of languages. We have staff that are fluent in languages such as English, French, Marathi, Hindi, and Urdu. As well, if clients present with a language that we're not familiar with, we do have interpreters that are helping us out too. So that is not another barrier for accessing dental care.
So the next location is Centre de Santé in Welland. That is where I work out of. We are looking to start our preventative clinic. Our tentative reopening date is June 7th, which is just a few weeks away. It is a tentative date, but I am very hopeful. And we do have a dentist, although we're not quite operational yet to offer those services. So hopefully they will be around the corner as well. We're really eager to get started. Like Shannon, we have staff that speak different languages at our centers. So we are, people tend to think our center is only for French speaking, but we are also offering services in all languages for Ontario senior dental care patients. And we have staff, all of our staff are fluent in French and English. And in our dental clinic, we also have staff that speak Arabic. But anyone who speaks any language well, no one will be turned away based on their language. So we can also get interpreters if needed. The hours on the slide does say 9 to 5. Those are our COVID hours. But prior to COVID and hopefully soon after COVID, we will also have evening hours available on Tuesday. So for, I know I've had a few people say, oh, my daughter's the one who drives me, but she works during the day. So we try to limit that barrier as well.
So coming soon, very soon, hopefully, the Niagara Falls Community Health Center. We're located at 4790 in Victoria Avenue in Niagara Falls. So back in the day, for those who are familiar with Niagara Falls, it used to be an old Canadian Tire building. So that's where we're located. And so our goal is to be open hopefully for mid-June. So we are proactively on the ball with and Philomena is here. So one of our team members from our dental team is here. So we have hired our team for dental for the seniors program. And we are now looking at contacting our clients to get those services started as soon as possible.
And the fourth dental suite within the Niagara region is going to be located in Fort Erie. It's not actually at Bridges, which is where I work, but it's going to be a Niagara Region Public Health building, 1264 Garrison Road. And this suite is going to offer preventative as well as restorative services, and it's going to be more accessible to those clients in Fort Erie, Port Colborne, Wainfleet. There is no set date yet, but construction is coming along, so hopefully very soon.
So last year, despite being in a pandemic and the only CHC operating in the Niagara region, Quest was able to provide an astonishing $250,000 of services. to our clients. And you can see the things that we did just before Christmas. We helped 62 people out with dentures at no cost, which was pretty fantastic to announce to seniors that for Christmas they would have teeth. And for some of these folks that we were talking to, hadn't had teeth in their mouth for years, for 20, 30, 40 years, and would actually be able to sit down and eat something on Christmas Day and going forward. So that was some really satisfying news for me personally that I was able to share. As we all know, through COVID, I know the other girls missed the socialization part of getting out and being in the public. So it was nice to be able to touch base with clients and bring good news to people. So that was just before Christmas. So hopefully we're super excited about the other centers opening up really soon and accomplishing the same results. And we're looking forward to that.
Questions, anybody?
You can either, if you're comfortable turning your mics on and asking questions, or you can post them in the chat if that's more comfortable for you. See if we have some questions, and we'll also have some questions after Felipe's presentation as well, but you're welcome to ask them now. Okay.
I have a question. It's Felipe.
Okay.
Oh my, can you hear me? My internet is unstable.
It's okay. We can hear you. Yeah.
Okay. Regarding to service providers, are community health centers the only locations available?
Sorry, what was the question, Felipe? My computer's going in and out too.
Right. Regarding to service providers, are the community health centers the only locations available for patients, or they can also go to private clinics, for example?
Right. No, so the Ontario Seniors Dental Care Program only operates out of community health centers, public health units, and the Aboriginal access units, and some mobile clinics. So that was, there was some confusion there. I know a lot of clients, especially because they're seniors, they've been going to the same dentist for many years, and they thought that now that they had the card, it just means that it's free now, and they could go back to, you know, Dr. John, who I've been seeing for years. But it's simply not the case. Yes, it's a ministry program, so they're set money in the certain areas, and that's where they're held.
Okay, thank you.
You're welcome.
I'm actually learning a lot about the program. Pretty exciting.
Oh, awesome. Good.
We also have a question in the chat from Joan saying, what about people who have no permanent address?
Who wants to speak to that?
Yeah, I can speak to
myself.
Oh, go ahead, Alesha.
Well, and join me if anything. So with the permanent address, I believe you still have to fill out the guarantor application, because that person who is applying for that client would still need to verify their income. Anna, what are your thoughts about that?
Yeah, so that's definitely a good way to go about it, is to go through the guarantor form. And again, that guarantor can just confirm that you do live in Ontario. I had an individual who was living in a rooming house, and he was frequently moving between cities. And so what we did for him is we actually just put Bridges address for him. And so that when he was accepted into the program, we received the letter. And the next time I was in contact with him, I just gave him that piece of mail. So it's just kind of dependent on what the individual is comfortable with, if they have someone to be a guarantor in order to confirm that they are an Ontario resident. But definitely, or if they are living in a shelter, let's say, then they can put the shelter address as well.
Yeah, I was going to say exactly that, Anna. We had a client, a homeless client that was staying at Southridge Shelter. So that's what the address was, and it was just marked down on the guarantor form, and it worked out.
I just want to add too, if this person, if an applicant doesn't have a permanent address, they could also leave, if they have a family member or a trusted friend that they can put their address on, that would also work. If this person does eventually get a permanent address, so there is a form that the client will have to fill out in order to continue receiving a new card, because every year you get a new one. So there is a form called change of information that this person will need to complete if they want to continue receiving correspondence once they've moved.
Perfect. Any other questions anybody has? Don't be shy. We're all amazing dental health community workers.
We're just wondering how the program is being promoted in the area. Like, is there certain areas that where the information is shared, or how do we get more information to share with people, I guess, too?
And so, like, with on our social media, each community health center, we try to do our best, and we follow the public health guidelines for posting too. So we tend to, if the ministry posts anything, we tend to repost that on our social media website. But the best thing just to contact us, contact your local dental health community worker, and we can spread the word. And even for this community presentation, if you know anybody who is in need of dental services, please feel free to reach out to us, as we can provide more information and connect them with the appropriate person.
Great, thank you.
I just saw another question. Someone asked if they had to become a medical client of the community health center. They do not. They do. A person who has a dental card and wishes to become or to get services at our center will have to have a registered chart with our center, but they do not need to have a medical doctor at our center or any other services. They can access our community health centers for dental, and only for dental if that's what they would like. Now, community health centers have other resources available, which we can extend those services to the client if they wish, but if they have a family doctor somewhere else that they like to keep, that's perfectly fine.
However, we do run into those clients that have no family doctor, and then that's perfect. That's when we say, are you interested in finding a doctor? We can help you out. And then it's connected with our CHC.
Great. Thank you for that. Okay, we'll have chance for a few more questions at the end of the presentation, and we'll welcome Felipe now. And Felipe will be sort of connecting why it matters, this program, and as well as having good dental care as we age. Welcome, Felipe.
Thank you. Thank you. Can you see my screen? Yeah. Okay. Thanks for having me, everyone. It's exciting. I'm honored to be invited to speak and talk about something that I'm passionate about, which is to discuss the importance of oral health. It's good to be back in Niagara. I'm not physically in Niagara, unfortunately, but ever since I immigrated to Canada, I lived in Niagara, and Niagara has a special place in my heart, and I consider Niagara as my Canadian home, if you will. And it's also good to see some familiar faces. I had the privilege of working and volunteering with some people here from the community health centers as a pre-dental student. And then it's good to come back today, be part of this event as a dental student, and hopefully in the near future, come back as a dentist to collaborate in other events. But yeah, so a little bit of an introduction. My name is Felipe. And I was born and raised in Brazil. While in Brazil, I attended dental school, but only for 2 years there because I immigrated to Canada. In Canada, I finished my undergrad at Brock University in medical science. And now I attend Western University, where I'm doing my dental training in London, Ontario. So to start this presentation, after this amazing presentation about the Ontario Senior Program, my goal here is to just type things up and to talk about the importance of oral health, and if you qualify, why you should be using, make use of this amazing program. And I want to start talking about oral health and overall health. it's really interesting every time I give a talk about it, because it's we tend to see these two as separate things, mutually exclusive, as an oral problem cannot be associated with a systemic disease, or as we say, or oral health and systemic health and overall health, where in reality, as any other part of your body, everything is connected. Your mouth is connected to the rest of your body. And if you think in that way, your mouth is actually one of the main entry points that connects the external to the internal. So definitely there is association between oral health and oral infections, just overall health and systemic disease. Over the past 2 decades, there's been a lot of epidemiological studies, so a lot of studies in the population that have had the goal of investigating associations between oral infections, especially periodontitis, which we're gonna get to quickly, and systemic disease. So these studies have shown that local periodontal infection, and just to clear up some terms, because I'm going to keep referring to it, periodontal infection refers to infection in the periodontium, and the periodontium are the tissues that surround your teeth, such as the gum and the bone, and they're responsible for keeping your teeth in place and supported. So any type of inflammation, any type of bacteria that grows within your gum and your bone, we refer that as infection in the periodontium. So local periodontal infection may be an independent factor that it is associated. It's actually an independent risk factor for certain disease such as diabetes, cardiovascular disease, dementia, pulmonary infections, and some types of cancer as well. Now, I don't know if you can see my mouse here, but if I can drag your attention to the picture I have to my left, to the left of the screen, this is just showing the 10 common chronic conditions for adults 65 plus in the United States, and the data is pretty similar to Canada as well. Now, if you look at the top 10 common chronic disease, I want you to pay attention to hypertension, which is high blood pressure, high cholesterol, ischemic heart disease, diabetes, a big one, heart failure, and chronic obstructive pulmonary disease. So the 6 conditions have been shown to be directly associated to periodontitis. So that's alarming alone, because out of the 10 top common chronic conditions, 6 of them have an association with oral infections. And I want to show some evidence, because that's how we do dentistry. It's evidence-based, and also it's only, you wouldn't trust only a dental student. So I just wanted to bring some articles to back up that information. Of course, I don't expect you to read the articles, but I did want to bring some of the articles that have been released recently from 2017 to 2019. And so one of them is oral health in the elderly patient and its impact on the general well-being. This study looked how oral health impacted the general well-being, and of course talked about systemic disease, especially diabetes and cardiovascular disease. The second study is specific for diabetes. That's a very interesting and important topic in dentistry. When you talk about oral health and systemic disease, diabetes and cardiovascular disease often comes back because there is a strong association between. We have also evidence summary about the relationship of oral infections and cardiovascular disease. And I'm going to be focused a little bit more on gum disease and cardiovascular disease, just to give an example of how oral infections are directly related to systemic disease, because gum disease or periodontitis or gingivitis are among the top 5 diseases that occur more often with older adult population, as well as cardiovascular disease. So I just wanted to put them together to exemplify what I said before. So a little bit of information here. I'm not going to get into the details of dentistry and all the hard terms. And if you have any questions, I can answer them at the end of the presentation as well. But when you look at gum disease and the heart, so if you look in here, that's a presentation of a healthy gum, and then you see the tooth, you see the enamel. Enamel is the hard part of your tooth. So when you smile, beautiful teeth. The white part we see, that's the enamel tissue. You see the healthy gum who lines the alveolar bone, and alveolar bone is the bone that is surrounding your teeth. So in a healthy patient, when there's no disease established, you have a certain level of bone, you have enough bone there. As soon as disease is implemented, so as soon as there's accumulation of bacteria, biofilm, due to either lack of oral hygiene or for whatever other condition, food accumulates in a space that we call the gingival pocket, where brush cannot clean. So if you look at the image here, that would be your gingival pocket here. And the brush, your traditional brush, cannot clean this space. The place where the teeth meets the gum and the bone, it's called the junctional epithelium. And that's where disease starts. That's where gum disease starts. It's a chronic condition that develops over a period of time. If you let food accumulate, or if you don't remove biofilm from there. In a very simple way of explaining it, as soon as food accumulate and you don't remove that, they're gonna lead to a inflammation cascade, and that inflammation will result in bone resorption. So if you compare the level of bone from a healthy gum to one with the disease established, you see the bone is much lower in a diseased one compared to a healthy one. And that's why when you go to the dentist and then they probe you, the probe shouldn't go further than 4 millimeters. Anywhere in a range from 2 to 4 millimeters, that's considered healthy. It's because you have bone right here supporting. So once you go with your probe, you can go further because it's touching the bone. However, when you have a disease, that bone is being resorbed. So when you probe, you can go down all the way to 12 millimeters. And if you don't take care of that, that will result in tooth. You're gonna have to extract, you're gonna lose that tooth because the tissue, the periodontium that is supposed to support the tooth, it's being degraded by bacteria. Now, how a gum disease, periodontitis, relates to systemic disease or heart disease. So how a oral infection, which is considered a simple infection, if you will, not lethal, can cause a heart infection that can cause death. If you look at in here under, can you see my mouse moving? Yeah, okay. So if you see the under here, or tooth is supplied, there's blood supply, and there's blood vessels connected to the tooth. If you have an infection around it, that infection bacteria can easily drain to your blood vessels, and you know where it's gonna go. It's gonna go to your heart. So it's not really rock science. Everything in your body is connected, and there is a real association between infection in your gum and heart condition and heart disease. And then here is just another chart that just pretty much shows what I just said. So there's an infection here again. The white are bacteria. The bacteria is being drained to the blood vessel that's going to your heart. It can cause heart disease, or the bacteria can be spread to other parts of your body because our heart pumps blood to other parts of the body. So that's simply how, and again, that's only one example of one oral disease affecting causing systemic disease. Of course, there are many other ways and examples that I could give, but I don't want to take more than 10 minutes. So yeah, I want to just show you that and hopefully make you aware of the risks. And so here again, just the importance of good oral health. And specifically for gum disease, since we're talking about it, those are just other examples. It is related to osteoporosis, stroke, Alzheimer's and dementia, cancer, respiratory disease, heart disease, a big one. Diabetes is also very important, and rheumatoid arthritis as well. So we talked about, I apologize for the pictures if anyone doesn't like it, sorry. After the talk we had and we learned about the OSGCP program, I wanted to talk a little bit about what you can get from these programs, right? It's not only, you shouldn't be only There's also prevention, as they mentioned, like you want to keep what is healthy and you want to make sure that you maintain, you are healthy. So I chose just 2 examples here. That's root caries, which is very prevalent in older adults. And usually it comes from gum recession, which is a gum disease. So if you look in here, that's what we call possibly periodontitis. I don't have an X-ray to guarantee that it is a periodontitis, but clinically speaking, it looks like the person has a periodontal disease here. And when you compare, you can see that the gum in a healthy patient follows the margin of the teeth. It is coral pink. There's some variation to what a healthy gum should like, but generally speaking, coral pink, not puffy, it's flat usually, and you see that it covers what should cover. When you compare to a situation where disease has been established, you can see that the gum, it looks redder, so it's a darker pink compared to a healthy gum. You can also see that there is recession, so that part of the tooth here shouldn't be exposed. And now, because it is exposed, now you can get caries on the root, which is a really bad prognostic. You don't want to root caries in the root of your tooth because that's supposed to support the tooth. So usually root caries can arise because of a gum recession that comes from a gum disease. Everything is connected. And those are 2 conditions that have high prevalence in the older adult population. And also, I wanted to talk about oral cancer because there's nothing better. There's no better treatment for cancer than early detection. And that's true for all cancers, especially for mouth cancer or oral cancer. And if you're eligible to use the program, the Ontario Dental Program, and you go to the dentist, you can prevent those things from happening. And the importance of oral cancer is that it can manifest in different ways, which makes treat harder for detection. So it can show as a red and white patch in the mouth. You can feel a lump or swelling in the mouth or different parts of head and neck and your lips. It can also be an ulcer, which does not heal with 3 weeks. So an open sore that doesn't go away, it should resume within 2 weeks. Suddenly you find an open sore that doesn't heal on its own. Those can all be suggestive of oral cancer. So by using this program, by having access to go to the dentist, you can prevent those oral conditions from happening. And of course, you want to keep health, you want to maintain whatever you have, maintain an oral health, but also if you have a disease established, if you have a condition that needs to be taken care of course, the program is also available to help you. And again, those are only the two conditions that have high prevalence in the older adult population. Condition where we call edentalism, when you have missing teeth. It can be partial, it can be full. In this case, the patient doesn't have any of the upper teeth, but it look often. And then, as we mentioned, this program also covers denture by a lower cost. So again, making use of a program to give you back quality of life and give you back your teeth and all the functionality of a teeth. Also important, there's a condition called xerostomia, is also known as dry mouth, that happens quite often in older adults. And it's usually a result of medications. We know that older adults are more likely to be on multiple medications. And as a result of it, as a side effect of it, we see older adults coming to the dentist because they feel their mouth is dry. And surprise, surprise, our saliva, it's very important to maintain a healthy oral cavity, because our saliva has enzymes that kills bacteria and keep your mouth moisture and gives lubrication to your mouth to maintain your oral cavity healthy. So if you don't produce enough saliva, you are at a higher risk of developing oral infections, such as gum disease or periodontitis, as well as cavity and caries. So I just wanted to bring some of the prevalent conditions within the older adult population. And actually, before I say bye, one more point I wanted to make, because I learned that with my grandmother, actually. I understand, I'm not going to be a hypocrite that now that I'm on my way to become a dentist, I'm going to say that everybody loves going to the dentist. It isn't flat. Nobody likes to go to the dentist. I don't like to go to the dentist. I go to the dentist because it is important, but it's not my favorite thing to do on a Friday afternoon. It isn't. Nobody likes it, but we have to, right? It's important for us. Dentistry has evolved and changed quite a lot in the past 20 years. And I understand that people who especially older adults, 30, 20 years ago might have had a totally different experience going to the dentist. Dentistry evolved, and most of the treatments we provide nowadays are, I can guarantee will be 99% of the time will be pain-free. And I understand that 20 years ago when you went to the dentist, you might have had a traumatic experience and you don't want to go back. You don't want to go back, and I understand that. But I urge you, if you're eligible to make use of this program, if you have access to a dentist, and if the only thing that is holding you back, it's fear because of a traumatic experience from the past, which is totally understandable, I urge you to give another try. Dentistry has changed, and we have come a long way to provide a better treatment for our patients in a way that it's pain-free. So I think it's important to make this point, especially because my audience is older adults, and I understand that 20, 30 years ago, your experience might have been traumatic, and that's what it's holding you back from going back to the dentist. My email is on the screen. I know it's long, so I'm going to leave here for a while if you want to write it down. I'm training to be a healthcare provider. I would love to get an email if you have any questions at any time of the day, any day of the week. I might not be the right person to help you with your condition because I am not a dentist, but I know people in Niagara. I might be a good first person to hear you and then put you in contact with the right person. And that's what I'm getting trained for, right? I'm training to provide health and to provide care. So if you feel like you have any questions about anything related to dentistry, please feel free to email me, and I will be happy to chat with you. And I think that's it. I didn't want to go too much in detail. Oral health is important. It is related to the rest of your body, and you should give special attention to it because, as I showed, research has shown a strong correlation between oral infections, especially periodontitis, and systemic disease. Thanks for the time, and hopefully I was able to share some of my knowledge with you, and you learned something new today. Thank you.
Great. Thank you. Does anyone have any questions for Felipe?
Felipe, you made a really good point about, older adults, especially if they experience a traumatic experience in the dental world. As Community Health Center, we do have services and support for those who are seeking counseling. It is all free. Please contact one of us and we can definitely help arrange that and get you set up for counseling support.
Great, thank you for that.
I have a dentist appointment on Monday and I will try to be brave.
You'll be fine. Just I tell grandma, make sure you talk to your dentist, let them know. They know you don't want to be there. We learned that in school. We know you don't want to be there. It's not so we need to do our best to accommodate, to make you feel good. So make sure you talk to them, let them know you're nervous and hopefully going to have a good experience, but don't avoid going because of the fear.
Okay, does anyone else have any questions for Felipe? Okay.
I do. Many of us are, as you mentioned, are on medication. And do you find that is having an impact on your training that you now have to be almost a pharmacist to know what kind of impact those drugs are having on our oral health.
Yeah, that's a good point. Throughout our training, dental school, every year we have a pharmacology course, then the pharmacy course, where we talk about drugs, and we need to know what drugs our patients are and how that impacts our treatment. And with special attention to older adults who might be on multiple medications, right? And definitely that alters some sort of treatments, but we are trained in school to deal with that, and that indeed we see like an increase in the number of medications that our older adult population take at one point, like you see 4, 5, 6 plus medications, and that it is impacting oral health, especially because of the dry mouth condition, the xerostomia condition, which is also it's not new, we know about it, but it's being vastly explored lately.
Great, thank you for that. Okay.
I may also interject. That's why it's very important, even in private practice or the community health centers, we ask patients to be honest and fill in a medical history. Sometimes patients will say, well, what does that have to do with my teeth? But for example, if you're on some kind of blood thinner and you're going to have an extraction, we may need to consult with your doctor in regards to stopping the blood thinners so many days prior to. There's a lot of meds that will contraindicate perhaps if you have a pre-existing condition and you might need antibiotics prior to a dental appointment. So medication and dentistry, of course, you know, they work together, and we need to know that. So it's very important for patients. Sometimes patients are embarrassed to say they're on lots of meds, and we can get a printout from your pharmacy, but it's always in confidentiality. Of course, it's private, but it's very important. So yeah, you don't necessarily have to be a pharmacist, but we definitely have to have that list to review.
I agree, well said. Oh, I can hear.
Is there another question in the?
Philippe, there's one. I don't know if I can read. Philippe, thanks for the educational presentation. You mentioned that some people have had bad experience with dentists. For people that are HIV positive and senior, are often rejected by dentists who are fearful of treating them. Are students getting training and supporting? Yeah, I am. This isn't. Oh, I can't say that, I guess. You should not be denied treatment based on your if you're HIV positive or not. That shouldn't happen anymore. I don't know how people have been trained in the past. We are being trained that that should never happen. I am actually surprised to hear that. Is it recent? But anyways, we are being trained to treat. Actually, there is not even extra precautions for being HIV positive. Dentistry, we do, every patient, we do the same protocols for health and safety, right? So there is no difference if you're HIV positive or not. So hopefully that won't happen again. And yeah, we are being trained to do better, I guess. I'm sorry that if that happened.
It might just be a question of clarification too, of inquiring whether that training is actually part of what you're actually, the courses that you're taking, because some people might be informed, but some people might not. So
yeah, because we have a course. We have a course, at least at Western, we do general medicine, and then we talk vastly about it.
Okay, great. Thank you. Okay, are there any other questions? Okay, well, I had my mic on, but I was giving a big hand to all the presenters today from the 4 community health centers. We really appreciate you coming on for this event today, as well as Felipe, and giving your time and your knowledge and being able to share that with us. Learned a lot today, and hopefully we'll have this recorded so that it'll be available for people who may have been missed the call to know how to access the program, because I think that's really important. Joan, is there anything you want to add there?
I just want to say that I learned so much this afternoon, and I didn't say much as a co-host, but I'm the quiet type, so I just let Judy ramble. It's her wingman,
And that's hey, we feed off each other well. So, and
thank you so much for taking the time to educate us. And I would like to think that, I mean, I'm a person of privilege, so I have a dental plan, but I am so glad that this Ontario dental plan is in place for people who don't share my privileges. So for that, I thank all of you for doing the work that you do to help citizens who do not have the privileges that the rest of us enjoy. So thank you.
And I'd also like to thank the participants that came on today. And being that this was the first time that Senior Pride Network of Niagara and OUTniagara partnered together to provide a Zoom event such as this. And we hope that it's the beginning of many more to come. So we hope that, you know, you'll watch our social media and join us again when we have, we're able to put together another event such as this. And the other thing I'd like to say is that with hearing the presentation from the community health centers in limiting barriers, that's something that the work that we do in both our organizations is working towards that. So it's really great to be able to partner with some other organizations that are that have that intention as well.
Absolutely.
So I don't know if anyone else wants to say anything that's on the call today, but if not, I think we'll say goodbye for now and watch our social media, and we'll hopefully have some other interesting topics to bring you.
Thanks, everybody.
Take care.
Thank you.
Bye.
Take care.
Bye.